This episode focuses on cervical cancer. And to help us understand this, we have Dr. Shona Nag, Senior Oncologist at Sahyadri Hospitals, Pune. Welcome, Dr. Nag. Thanks for being here.
Thank you.
Doctor, please tell us about the basics of cervical cancer and how commonly it is seen among the urban women.
Okay. So basically, cervical cancer is nothing but a tumor that arises in the birth canal of the woman, and there are several risk factors for this. Luckily, it is not so common in the urban woman because the rate of childbearing is relatively low. It is commonly seen in urban India amongst the commercial sex workers. It's pretty common because they are exposed to multiple partners and they get multiple infections. Cervical cancer is related to a virus called the human papilloma virus, and this comes during sexual contact, and it is something that can be treated and something that can be picked up really early through a pap smear.
Okay, so what are the basic causes, as you said? One is like
So
having multiple
risk factors are opposite that of breast cancer.
Right.
An easy way to remember
Right.
it. So women who are married very early, who have lots and lots of children,
Okay.
then multiple sexual partners, then non-hygienic ways of life, where they don't keep themselves clean, where childbirth is not done in a good surrounding, so the rate of infection is very high. So these are simple things that we need to remember. Urban India has less cervical cancer than rural India simply because the pattern of childbearing is quite different. And even though cervical cancer is the biggest killer in our country, in fact we have the world's, say about 1/4 of the world's cervical cancer is found in our country. And it is really sad because we find it in stage 3 and 4 and it can never be cured at that stage, whereas in the West we are able to pick up cervical cancer in stage 0 and stage 1 through a very aggressive pap smear screening program, and unfortunately we haven't been able to implement that here.
Cervical cancer doesn't present with pronounced symptoms in early stages?
No.
That's why it is not picked up early?
Exactly. By the time it's late, when you have a florid, huge tumor which is seen with the naked eye, there is pervaginal bleeding, there is bleeding in between menstrual cycles, there is bleeding during intercourse, there is a foul smelling pervaginal discharge. Now for it to reach that stage means it's pretty advanced. So early cervical cancer may not have any symptoms, and therefore a pap smear can diagnose it in stage 0 or stage 1.
Okay, and what is the right age you said to begin the screening?
The right age to begin screening is actually when a girl becomes sexually active in India. That is not very acceptable. So we say after the age of 21 or 22, or as soon as the girl is married.
And then on what interval it should be taken?
Basically every 3 years, right up to the age of 65, after which it's rare to see cervical cancer.
Okay. And we have been hearing a lot of things about the cervical cancer vaccine these days.
Yes. So basically it is not really a cervical cancer vaccine. It is a vaccine against the human papilloma virus.
Right.
So from the time the infection starts to the time it develops up to cervical cancer is a lengthy period of 20 years. Right? So God has given us 15 to 20 years to pick up these abnormalities. And like I told you earlier, cervical cancer found in situ or in that particular place in stage 1 can be cured by a cone biopsy alone. Don't even need a hysterectomy or a surgery. But when you have a cervical vaccine, it prevents viral infections, which then doesn't progress to cancer. So it is actually a HPV vaccine, which then prevents not only cervical cancer but genital warts, which is a very common condition, especially in the West, right? So these are the things that are prevented, but it doesn't mean that you have the vaccine and then you don't do pap smears. You have to do both together.
Not a substitute to pap
It's not. And most people say, "Arey, I've had the vaccine, nothing's going to happen, I won't do the pap smear."
No.
It protects against 80% of all viruses. 80% of HPVs, and therefore we need to do the pap smear.
Okay.
So 2 together is almost 100% guarantee. And this vaccine is to be taken from age 13 to 25 is the best effect.
Okay.
So the lesser partners or the lesser exposure, like if a virgin has this vaccine, it will build up antibodies, like all vaccines do.
Right.
And when there is an onslaught of viral infection, it can kill that viral infection. So no use having had tons of children and very late into your 30s and 40s, there's no effect. Right? So the best effect is 13 to 25. Until 35, we do recommend it. It's a shot of 3, so 0 months, 1 month, and a booster at 6 months. The cost is approximately 2,000 per shot, but it's a lifelong immunity, so it's worth it. There are a lot of reports, is it safe, is it not? It's perfectly safe. In fact, I've vaccinated my child, so it's very important to do it.
Yes.
Yeah.
In the news recently, we have been hearing about this vinegar test
Yes.
to detect cervical cancer.
So we're all very
What's
proud because this huge study was carried out at Tata Memorial Hospital, where we have all graduated from. Basically, pap smear is not cost effective. You need to get to thousands and lakhs of women across India. In the villages, no gynac is going to go all the way and sit and pap smear everybody. Rural India is also very resistant to any form of invasive testing.
Right.
So basically a whole lot of medical social workers were taught how to study color changes between the benign and malignant cervix.
Okay.
So basically acetic acid, which is nothing but vinegar, is applied to the cervix, and the social worker is then taught how to look for color change.
Okay.
When it is malignant, the color turns brown.
Okay.
So it's easy. So there's
Visually
a
you
visual
can see.
inspection of the
Okay,
cervix.
and quick.
It's called VIA. It's very quick, and these workers were trained repeatedly so that they could pick up small changes. These people were then, with the color change, so there is a suspicion of malignancy, were then sent for a pap smear and further testing.
Okay.
It brought down the mortality of cervical cancer by 30%.
30%.
Huge impact.
That's huge.
Almost 1/3.
Yeah.
And that too by a simple, inexpensive test which is non-invasive. So that is the vinegar test which is
So
being
does
done.
it check for the precancerous? And
You
cancer?
can, so precancerous and cancerous both, in which case the preventive biopsies or whatever can be done. In cases where the tumor is a little larger, then a surgery may be required. But it screens a large population over a large area without any very expensive testing and all. And it's
no
very
lab required, nothing.
And you don't require skilled slides or anything. You require a torch, you require a good trained person, and it can be done in rural India. Now this test is also being, India is in talks with all the SAARC countries for taking this test to other developing
It's a major
countries.
breakthrough.
It is a major breakthrough, yes.
Thanks, Dr. Nag.
Not
Thanks
at
a
all.
lot for joining
Thank
us.
you.
Ladies, go for screening tests, have a pap smear done, get vaccinated. Do whatever it takes to curb this deadly but preventable form of cancer.